Hello, my name is Maria and I'm a grad student at William Patterson University. There's a lot of talk about personalized medicine and how one shoe does not fit all. Well, I wanted to focus on estrogen's neuroprotective role in traumatic brain injury. Estrogen plays many roles in the body, and there is increasing evidence that estrogen system can be a target for therapeutic treatment. This study looked particularly at the function of beta, which is an estrogen receptor with anti-inflammatory effects. So activating this receptor may help reduce some of the symptoms of TBI by decreasing cell death. I examined the behavior changes of female mice with and without endogenous estrogen before and after a severe TBI on the parietal cortex. Also, mice were administered an beta agonist or antagonist. The graphs are showing the analysis of two behavioral models, open field and balance beam. In the open field, mice showed an increased fear behavior by spending less time in the open center area at 3, 5, and 7 days post-TBI. This change was observed regardless of estrogen being absent or present. Also, activation or deactivation of beta did not prevent the increase of fear behavior. Now, this is consistent with the reported post-concussive symptoms observed post-TBI. In the balance beam, the time it takes mice to traverse a 1 meter narrow beam is used to examine motor coordination skills. So here, mice with endogenous estrogen that were administered an beta agonist show motor coordination deficits only at 5 days post-TBI. In comparison, mice with reduced endogenous estrogen that were delivered with an beta antagonist show a motor coordination, again, only at 5 days post-TBI. All the other treatments show no motor coordination deficits. Now, the take-home message is that here, estrogen may be playing a role in the short-term motor coordination skills post-TBI, and also that fear behavior occurs after a TBI regardless of estrogen. For future studies, we need to address the long-term effects of estrogen post-TBI and perhaps examine long-term symptoms such as memory loss and PTSD.